guys, it's me, Angela, again. So this video is going to be about borderline personality disorder, which I have struggled with for a very long time. I was diagnosed at 21, and I'm on disability for borderline personality disorder, which is really annoying. I have my phone, and I'm going to read off the symptoms for you guys, just in case you guys don't know what borderline personality disorder is. So, here we go. Oh, and I wore my hoops today. Like my hoops? Hoops. It's been a long day. Anyway, here are the symptoms. Splitting, which is thinking in extremes. Where everything is either black or white. There's no gray area. Another one is chaos in relationships. And, the reason for that is that if you feel rejection of any kind, because, the big thing about borderline personality disorder is, the fear of abandonment and rejection and negative criticism and anything like that. So, the reason you have chaos in relationships when you have borderline personality disorder is because, you either love them or, hate them. There's no, in between, really. And your emotions go insane all the time. Let's see, what does it say? Intense or uncontrollable emotional outbursts. Usually anger and sadness. So if your boyfriend or your friend or whatever says something that makes you really sad, it's more you feel bad about yourself more than anything, because for me, I was I try so hard to not, do emotional outbursts, to be super emotional and stuff like that. Because if you do that in relationships, if you just are a ticking time bomb, then nobody's gonna want to be your friend or date you. And that's why all of my relationships with boyfriends and girlfriends never went past 3 months until I met a guy about 3-4 years ago. We were together for 2.5 years. And I have a new boyfriend now. Yeah, he's long distance though. It's kind of annoying, but hopefully he's gonna visit soon. But anyway, so that's why my relationships had only been 3 months long, at the very most. Because because of me, yeah, anyway, here's some more symptoms. Let's get back to the friggin' thing we're doing. Okay, markedly disturbed sense of identity, and I still very much struggle with that. Basically, you kind of don't really know your personality, who you are as a person, because you don't really like yourself. Sometimes I've been different people, a lot. For instance, back when I was with my abusive boyfriend, I was very, very quiet, very shy, very no confrontations, because I just couldn't handle it. And so I was a floor mat, and everyone took advantage of me. That's how I used to be until maybe 3-4 years ago, probably less than that. And then I was kind of just, you know what, I don't give a fuck. I'm gonna say what I feel. I'm gonna be real. I'm gonna be the realist me I can be. So now I definitely feel like I am myself, but in the past, I've definitely, my personality has changed a lot. And a lot of treatment centers that I went to, I think like two or three of the places I went to, I basically spaced out like the entire time because I was having big problems with dissociation and my identity, basically. Like, I didn't feel like myself at all, so I didn't make any friends at those places, and therefore I hated it and got worse. And, that's when, those are the times in my life where my self-harm has gotten the worst that it's ever been. Because I was like, I don't really know who I am, yet I want to, like, have friends. But I couldn't make friends because I was just, like, in my own world. I didn't know who I was. It was really weird. Yeah, so, okay, let's see. Next symptoms. Unstable interpersonal relationships and self-esteem. Pretty self-explanatory. Concerns about abandonment, that's the big one. That's a huge one. And it's usually if you have borderline personality disorder, you have been through some kind of abandonment or neglect or stuff like that, like when you were younger. It also, you can get borderline personality disorder later on in life if earlier in life you were very a very invalidating environment. Yeah, so validate, it's a big thing. Validate people. People need it. Self-damaging behavior. That can be anything from drugs to, like, driving too fast to cutting, burning, eating disorder stuff, like excessive spending. I've done all those except for the spending, the one. I've done all the other ones. And impulsivity. Big one. I used to be so impulsive, like, not, like, seriously, like, didn't even think about the consequences. I was just like, you know what, fuck it, I don't give a fuck, like, I don't care, I'm just gonna do this, I don't care. And I have to really rein myself back a lot of the time because I'll be like, oh, I really want to do this, or I really want to do that. Like, for instance, like, I hate living at home. I hate not having a car. I hate not having a job. And, if I was back to impulsive me, I would probably run away. Because I've done that before. And, like, live on the streets. Which, I did a couple times for, like 2 days at a time, and then one time it was like for a week. I actually really like living on the streets. I know that sounds kind of weird, but I'm free. I'm not. My mom is. Yeah. I'm gonna do like a whole friggin' video about her. Like, she is nuts. Anyway, so yeah, that's basically. Oh, here we go. The last one is frequently accompanied by depression, anxiety, anger, substance abuse, or rage. I have dealt with all of those. Especially rage, like big time. I call myself the Hulk, because the Hulk, I'm a huge, like, comic book nerd. I used to read so many comic books when I was younger. And I always loved the Hulk the most because he's a pacifist with anger issues. And that's me. It's kind of funny, actually. I'm wearing a peace sign shirt. And I have a peace sign tattoo. That if I get to a point where I explode, like, for example, the last place I was at, I was in a lot of pain because I had just it was so stupid. Like right before I went in, I like took a bunch of pills and just walked down the street. Which is a really horrible idea because I kept falling, hitting my head, hitting my body, and then of course somebody called 911, and I was put in the psych ward, which was really fun. Psych wards in Indiana are different than the ones in California. But anyway, so I was in a lot of pain from that, from falling and all that stuff. And I really wanted some kind of relief. I needed to see a doctor. I really did. But they just kept dropping the ball on that. And I got to a point where I was like, how about you give me the number of the doctor that you send all of your people to? Sorry. And I will just call them and make a freaking appointment because you guys obviously can't do it. And I had my doctor's appointment like at least a month after I got there. And I should have seen him within the first week. And it pissed me off. So what I did, I hulked out is what I call it when I do this. I hulked out. I basically went outside to the smoking area, and there were a bunch of tables and chairs and stuff. And I started throwing the chairs and like knocking over the tables and just being in a huge rage and just be like, fuck this shit. And I had my current boyfriend I met there. He kind of like restrained me while like two other of the residents like put all the shit back so that I wouldn't get in trouble. Yeah, and I'm actually, when I rage out, when I hulk out, I'm pretty strong. And it was these like black like metal chairs. They were like metal. And I guess it turned out that I had thrown it so hard that I broke off two of the legs. Metal legs. So, yeah. And every one of the 9 treatment centers I've been to has been for borderline personality disorder. Because my mom is obsessed with that diagnosis. And yeah, I know that back when I was younger, I was definitely very, very borderline. It was horrible. And then like maybe 2 years ago, I started feeling like I was growing out of it, which you can do. What that does happen is you can grow out of borderline personality disorder. So I was like much more normal. Like my emotions were much more in check. Like everything was just like, and it felt great. It felt great to be like normalish. It was amazing. And then for some reason I just went back. And it sucks. It fucking sucks. Especially since my mom is so obsessed with my diagnosis. Especially, she's obsessed with DBT, which is Dialectical Behavioral Therapy. It's a mouthful. And that is basically the front runner of the kind of therapy to help with borderline personality disorder. So my mom, ever since I got the diagnosis, has been obsessed with it. She even teaches a class to like family and friends of people with borderline personality disorder, like how to cope with their loved one that has borderline personality disorder. Yet she treats me like crap because of my borderline personality disorder. It really pisses me off that she teaches that class because she sucks at treating me like a human being. Like, yeah, again, there will be a video about my mom. But anyway, this one, borderline personality disorder, if any of the symptoms I rattled off seem like, oh, maybe I have this, then go Wikipedia. That's where I got it. I just read it off Wikipedia. It's simple. You can even take like online tests for borderline personality disorder. And so how to deal with borderline personality disorder is, again, the front runner, DBT. And DBT is basically, it was developed by Marsha Linehan. That's kind of important to know because her name is, like, on every DBT thing. If her name is not on some, like, if you're going to, like, get a book about it or, like, read about it online, if Marsha Linehan is not the one that's written that book or that workbook or anything like that, don't get it. Because she is the one that invented DBT, so she knows it better than anyone. Plus, she used to have borderline personality disorder herself and grew out of it through adopting these skills. And so DBT is basically, it's a bunch of skills. It's a bunch of just, like, normal shit that, like, you'd be like, duh, but in reality, a lot of the skills are actually pretty difficult, especially at first. They try dialectical, basically means, like not black and white. It's, like, against black and white thinking. It's like you have emotion mind, and you have rational or reasonable mind. It's called two different things. And when they go in the middle, a little circle, and you have both of them, that's called wise mind. And here, let me look up some skills and shit. 1 second. Come on, phone. Alright. DBT. Where are you? Okay, let's try dialectical behavior therapy. There we go. Okay. Sorry, you guys. Okay, so there are 4 different modules, and they all have their own skills. The first one is the mindfulness one. If you, like, are thinking about or, are going to be going to, like, DBT classes to learn about DBT, the first thing they always do is the mindfulness module. Mindfulness is, like, a super big deal with DBT. Mindfulness basically is let's see, how do I do this? Okay, it says within DBT, it is the capacity to pay attention non-judgmentally to the present moment, about living in the moment, experiencing one's emotions and senses fully, yet with perspective. So it's like meditation, because with meditation, you are in the moment. Mindfulness is basically all about being in the moment, because a lot of times you'll get ahead of yourself. You will kind of either be thinking about the past or the future, and that's really how I used to be. And a lot of people really do mindfulness and stuff because it really helps with life. Like, it really, really does. Because so many people are just, like, busy and just running around and just, like, they don't take time to appreciate the moment. So that's mindfulness, basically. And there's a bunch of skills from that module. Next one is distress tolerance. That basically means it's a bunch of skills that, let's see, let me do this. Okay. Many current approaches to mental health treatment focus on changing distressing events and circumstances. So, like, for instance, I didn't get a job, and I did a bunch of interviews, yet I don't have a job. And that is distressing in itself, because it's like, I need to have a job so I can make money, so I can get a car, and then like my own place, and get the fuck out of my parents' house, which I hate living at. So there's, I mean, and you know, since I got rejected by basically everyone except for like a couple places, but then it turned out to be something different. So it's annoying. So it's like, skills that I used is I just kind of accepted it. You can either change or accept. Those are the things in DBT. If you're dealing with a distressing situation, you have two options. Two. You either change something in your environment or in yourself or etc. And then that in turn will help with whatever is distressing you, because you're changing it. And then accepting is basically, radical acceptance is a big thing. So you basically radically accept your situation. And then you learn to be like, okay, this is just how it's going to be. I just need to accept this. Which I use every freaking day living here with my parents. It's just being like, right now I'm trying to change it with getting a job and stuff. But at the same time, I need to accept that I am here for now, and that my mom is not going to let me move out with my disability money that she's in charge of. Let's see, and then where is it? Okay, and emotion regulation is another one, another module, and that one's basically, about learning how to regulate your emotions. Duh, it's called emotion regulation. It teaches you how to like figure out what emotion you're actually having. And then from there, you can kind of figure out what to do. It's strange to me that a lot of people don't know what emotion they're feeling. Probably because I've been in so many treatment centers, done DBT for so effing long, have so many therapists, that I know every emotion I'm having every time I have an emotion and why. And I kind of wish I didn't always do that, because it would be nice to just be like, oh, okay, I'm just whatever, and I'm just gonna chill. But instead, since I've been bombarded with DBT and therapy, I always have to figure out what my emotion is, and then always immediately try to fix it. And that gets old. Anyway, and then the last one is interpersonal effectiveness, which is basically skills on how to deal with your relationships in your life, whether it be wife, husband, boyfriend, girlfriend, friends, co-workers, bosses, all those people, everyone that you have a relationship with. And the big ones are, they're all acronyms. Dear Man is the one where you are asking somebody for something that you want. And, look it up, basically. The acronym tells you, it's like, describe the situation, express the what you want, etc. I don't do that. I've found that it takes way too long, because, Dear Man, there's a lot of letters in there. And it just tends to be better when I ask for something that I want, that I just am like, hey, I would really like this to happen, and this is why. Which is kind of like a mini Dear Man. Another one is called FAST, another acronym, of course, and that's about keeping self-respect, which is basically the skill that's like, man up, don't be like a carpet people can walk all over like I used to be. That's basically what this one is. This is, you know, whatever someone says or anything like that, you can just be like, well, you know what? This is how it is. I'm not gonna, like, roll over, backwards, whatever, you know, to, like, make this happen for you or anything like that. Anyway, and the last one. Why aren't you here? Let's see. Oh, there's GIVE. Okay. Now another acronym, which is giving something. This basically is how you maintain good relationships with people. And I think that's probably the best one out of the three ones that you can do to help with relationships. Because it tells you, you know, be gentle, you know, don't, you know, no verbal or physical attacks, you know, which I've done. I've, you know, I've punched my mom before. Not proud of it. But, again, my mom is just yeah, and act interested in what people are saying. That's like a duh. Validate. Big thing in DBT. Validate. You gotta show that you understand person's situation and sympathize with them. But validating does not necessarily mean you agree with whatever the person's saying. What you're doing is just being like, oh man, that really sucks. I'm really sorry that you're going through that. That's how you validate someone. But it doesn't mean that you are agreeing with whatever they're saying or think that what they're saying is right or wrong. So those are the modules for DBT. You can also do CBT, but the DBT community hates CBT. Yeah, it's kind of funny actually. So yeah, I guess that's like really the end of my video. I know it's really long. I'm sorry. So basically we went over the symptoms, went over which ones I have kind of and like deal with and stuff, and then we went over DBT and the 4 modules. Again, if you want to learn about DBT, I suggest you go to, what's it called? Marsha Linehan. Basically look up Marsha Linehan, and there's going to be a website to go to her. Let's see, I know what her website is. Marsha Linehan. Okay, here we go. So her website is, well, it's behavioraltech.org. And that's basically her website. And you can go there and you can learn all about DBT, and DBT works for even for people who don't have borderline personality disorder. The thing is, it works if you work it. I know it's like a thing people say in like NA and AA meetings, but it's very, very true. It works if you work it. If you don't work it, or like completely are 100% in, you won't get anything out of it, and nothing will change, and you will still be in emotional pain. So, it's your choice. It is. You have a choice. Even if you don't think that you do, you do. So anyway, that's about it. I am signing off. I will see you guys on the flip side. Peace out.